Let's go ahead and get started on this. This is kind of our update regarding the 2024 upcoming annual election period, that AEP period, really for the Part D drug cards, so those standalone drug cards for those of you that have a supplement, and a little update on the Part C, which is the Medicare Advantage plan. A couple of housekeeping items before we get going here. This should only take 20 to 30 minutes. My noon class was right at 25 minutes. This is just a general update. So if somebody was here expecting me to go over specific plans in terms of their premiums, the copays, the medications that are going to be on there, we don't actually have that information yet. That information won't be released until October, but there's a lot of big structural changes that are happening here. And we just wanted to give everybody kind of an update, a heads up. Hey, we are hearing this is going to be one of the biggest changes in both Part D and the Medicare Advantage plan since the system was implemented in 2006. We will have just a very brief question and answer session at the end. We've got a lot of participants on this, so you're going to stay muted. So use your chat feature. If you see something, you have a question about it, go ahead and hit that chat button and just type your question in. At the end, we'll get to as many as we possibly can. But I think from experience from the first one, it may end up, if we don't get to your specific question, we'll be sending out an FAQ after this talk. And, some people asked in the first one, hey, are we going to get the slide deck? Yes. So this is being recorded. We'll send that out to you. We'll also send out a PDF version of the slide deck. So why are we here tonight? This is all about some things that were implemented or are going to be implemented from the Inflation Reduction Act. So this was a law that was passed in 2022. Part of it really had the aim to help seniors who are on very expensive medications. And there are some big structural changes that are going to happen starting January 1st, 2025. So first of all, let's talk about these changes. The biggest one of the big ones, is a $2,000 maximum out-of-pocket limit. This has really never existed before for any Part D drug coverage, okay? So prior to 2025, we had all these stages drugs were covered in: the initial coverage stage, deductible, catastrophic phase, donut hole, right? And even if you hit the catastrophic phase, which it took over $8,300 to get to, even if you hit that, you were still going to be charged some for your medications. There was a small cost share. That goes away in 2025. And no matter, what medication you're on, how expensive it is, as long as it is on your drug card's formulary, the maximum you could spend out of your pocket for the year, calendar year, is going to be $2,000. Okay, we're going to get to some examples in a minute where you might not even have to spend that much to get there. So this is a big change for people on Medicare. They're eliminating completely the donut hole or the coverage gap, right? So that was a period of time where if you accumulated a certain amount of costs out of your pocket, you hit that donut hole. Now your copays went away. You were paying percentages for your medications. And so most seniors saw their costs really go up during that coverage gap or that donut hole. Well, that is now gone. So we're down to 3 phases here, and really only 2 of them that are going to apply to you. Number one, that deductible phase, right? So if you get a drug card with a deductible, you have to pay that up front. There's the initial coverage phase, which is where you're going to get some cost sharing from the Part D drug cards. And then as soon as you hit that 3rd stage catastrophic phase, you've hit that $2,000 max out of pocket, you're covered at 100% above that number, okay? Next big thing is this optional copay smoothing program. Okay, so here's what this means. Starting next year, you can opt in to a smoothing program. And I'm going to use an analogy here, which is basically like your electric bill. So a lot of electric companies will allow you to say, hey, make my bill the same amount every month, so I don't get hit with a big charge in July when I'm running my AC. Or, January when my heater's getting run, right? So what they're going to do is they're going to take your medication costs and divide that large number up front. Let's say you have a very expensive medication. Your first bill is going to be $1,000. You opt into this program, they're going to tell you, hey, we're going to take this $1,000 and you're not going to pay the pharmacy. But what's going to happen is your drug card is going to accumulate that cost. They'll pay it. Then they're going to divide that $1,000 divided by 12 months, and you'll pay it in premium from your drug card. Okay? You can opt into this program at any time during the year, and whatever that cost is going to be spread out. Okay, it's going to be spread out over how many months you have left in the calendar year. All right, so this is going to be, we don't really know how this is going to work. It's never been implemented before. And all I can say is I would be just a little, you never want to be the beta tester for this type of thing. I would just make sure if you're going to try this, you pay attention to the bills that you're getting from your drug card. Make sure they're including the cost of your medications. All right, but that could be big for a lot of people from a budgeting standpoint. Okay, and then finally, another one of the big structural changes, we're really moving the responsibility for the cost of the medications from Medicare itself to the Part D drug card carriers. And we'll see some examples in a second and how that's going to work. All right, so here's kind of a chart of what drug cards look like in 2024 and what they're going to look like in 2025. So let's look down at the bottom. You can see the colors represent who's paying for the medications. So dark blue, Part D member, that's you all who have drug coverage. The Part D plan, that's your insurance carrier. Orange is the drug manufacturer. They were required to give discounts. And then the yellow is Medicare. And what I really want to shift your attention to or point out here is let's look at this catastrophic phase. This is where the big change occurs. So this year, if you hit the catastrophic phase, which again, you had to reach over $8,300 in medication costs out of your pocket, if you hit that, then the drug plan was only responsible for paying 20% above that number, and Medicare was paying 80%. That really changes in 2025. So in 2025, you hit that catastrophic phase, and again, it's only going to take $2,000 to get there. Now the drug carrier is responsible to cover 60% of your cost. The drug manufacturer is going to give a 20% discount, and Medicare is only paying 20%. All right, big change behind the scene here. Let's look at a couple of real world examples of how this could change your medication costs. All right, so item number one in this chart is what 2024 looks like. So let's pretend this individual for this, I think, had a tier 3 medication on a drug card, and that tier 3 copay was $47. So you can see January through May, they're just paying $47. But as soon as they hit June, they're into this donut hole, and they've seen their cost increase, and now they're paying $250 for the cost of their medications. And they're going to run that through the remainder of the year in that coverage gap or that donut hole. So overall, they've spent $1,985 for those meds. Now, let's take a look at items 2 and 3. These are the 2025 drug cards. The only difference between 2 and 3 is whether your drug card has a deductible on it. Let's pay attention to item number 2. Pretend your drug card doesn't have a deductible. So you start off with that same $47 copay, but now look what happens when you hit August. You've hit your catastrophic limit for the year, and you don't owe anything else from August through December. So your total out of pocket is $329. Now, I know what some of you are asking. You know, Chris, you told me that out of pocket was going to be $2,000. I had to spend $2,000. Well, what that means is you have to accumulate $2,000 to what they call the true out of pocket cost. And by rule, this is going to charge and accumulate either the higher of your copay or what that line item on number 4 says the drug cost. That's the defined standard cost of that particular medication. Well, let's look at January. You have a $47 copay, but it's not that $47 that starts accumulating to your $2,000. It's the defined standard definition of what that drug costs to Medicare, and you're going to get credit for $693 toward that $2,000, right? So now you see, as soon as that line is the one that matters, when it hits $2,000, your costs go away. If we look at item number 3, what's the difference? Well, in January, we picked a drug card that has a deductible. So we're going to pay that $347 up front and then hit our copays. So we accumulate a little bit slower, or there's actually more of our costs out of pocket, right? And now our total that we've spent for the year is $629. In either case, you've hit that max out of pocket well before hitting $2,000 out of your own pocket, right? Again, big change here in how things work this year. So that's a list of some of the things that we know are coming, right? Those are factual, structural changes that are going to be implemented January 1st, 2025. So I'm guessing some of you out there have already realized what some of these ramifications could potentially be, right? So cost, the meds are shifting from Medicare, shifting from you as the enrollee to these drug cards. We haven't seen anything specific, but all the drug carriers are telling us, hey, prepare your members. They're going to see exponential increased premiums. Probably going to see higher copays for the medications that you're on, right? So larger upfront cost share to you if they can do it. Reduction in the number of drugs a drug plan is going to cover, right? We're used to drug cards covering hundreds and hundreds of medications. They're probably going to scale that back. Maybe a drug card covered 4 alternatives and a couple of brand drugs were on there that were very expensive. Maybe they cut that back. Now they're only covering a med or 2, right? So reduced restricted formularies. Reduction of the plan Part D options. So right now we've got 7 or 8 carriers, each of them offering 3 or 4 plans, a lot of plans to choose from. We're hearing, hey, that's going to be scaled back. There might be some companies that don't offer drug cards anymore at all. If they do, they might not offer 3 or 4 options. They might offer 1. We just don't know, but that's what we're hearing. And then kind of a reduction or elimination of $0 premium plans, $0 copays. A lot of people, most of my clients probably have a drug card less than $20. Those days are probably gone. $0 premium drug cards, probably out the window. Might not be very many options for drug cards that have $0 copays for tier 1, right? So again, these are all ramifications of those structural changes. We will not know any of these details until October 1st. But this is the same story that you see listed here. We're hearing it from every single insurance company, right? They're going to have to do something to combat how much cost they're taking on, and that's going to probably lead to higher drug cost premiums. Okay, so that's our drug card. Let's talk for just a minute about the Advantage plans. Advantage plans are going to have some ramifications as well. So Advantage plans, most of them include the drug card built in. So all those things we listed about Part D, these Advantage plans that have the drug card built in, probably going to suffer some of these same effects, right? Second thing is, these Advantage plans, not only do they cover the drugs, but they also cover medical use. Well, there's been really an increased usage of medical care post-COVID that they weren't accounting for. There's also been a reduction in the reimbursement that they get from the government. So when you go on an Advantage plan, the government, you've outsourced your care to the private carrier. So the government's going to pay that company each month. Well, that wasn't as large as what these Advantage plans had hoped for going forward. So what does all this mean for the Advantage plans? Well, everybody's used to these commercials with Joe Namath, right? Get your benefits that you deserve: dental, vision, hearing aids, transportation to the doctor, grocery cards. Well, we're hearing, hey guys, prepare your members. We're probably scaling a lot of that stuff back. Right? So all these extra bells and whistles could very well be reduced when we get into October. One of the things to be aware of when we're talking about drug cards that are going to go up exponentially, you know, the more expensive your supplement and drug card route are, the more attractive an Advantage plan could potentially look to you because they usually have lower premiums. So it's going to be a lot of, you know, combating, hey, why did we go with the Medigap route in the first place, Chris? Well, you know, that goes back to why we're picking that versus Advantage in the first place. Easier to use doctor network, services may be covered easier, right? So don't just fall for, hey, what's my cheapest option? Got to really pay attention and be aware of what the value is that you're paying for. Not to say that Advantage plans won't be a good option. Just don't, you know, do your homework, be aware of what's coming. All right, so what can you do now? All right, so really officially nothing happens until October 1st, right? We won't have plan details until then. Possible to really shop for alternatives until that date, but be on the lookout. You're going to get something in the mail called your annual notice of change, or ANOC. Going to be very important this year. Should be to you in the mail by the end of December. Probably a lot of you just threw it right in the garbage without even looking. This year, you're going to want to look at it. Okay. All right. It will list in there what your new premium is going to be. It should list in there, hey, we have a list of these medications that you're on. These are the ones we're no longer going to cover, or this is what the increased cost is going to be. Right. So you'll be able to see, hey, oh, look, my drug card only went up a little bit. It's keeping all my meds. So be on the lookout for that annual notice of change. Second thing, prepare your medication list. Know the medications you're on, whether you're taking the brand version or generic. Get all your dosages straight. Know your frequencies. We haven't yet decided, because we need some more information on how we're going to assist you all during this time period. You know, if you've been with me for a long time, you know, for years, we're kind of tinkering and adjusting and trying to help you guys the right way. You don't know what that way is going to be quite yet, but have your medication list ready to go, right? We're going to be guiding you through this in one way or the other, right? So again, be on the lookout. Just like you found this email and you came tonight, we're going to continue to communicate with you through email. Got a lot of clients to deal with, so that's the best way we can kind of communicate en masse. As a reminder, the annual election period does start October 1st. We can start shopping drug cards and Advantage plans at that time. The enrollment starts October 15th, and then the deadline is December 7th. So October 15th to December 7th, it's our go time. All right, everybody, I told you this was going to be a brief presentation. Took me 18 minutes there to get through that. Again, just a heads up, we want to stay in touch with you guys, get as many things answered now before we get into open enrollment and get really busy. So hopefully you found that valuable. Really just, you know, be diligent, pay attention to what's coming, read the communications from us, from your drug card carrier, and hopefully this helps you absorb what we're being told might be some shocking changes as we get into October.